Good morning, everybody. So intestinal microflora is a big population. It's not found, it's more found distally. It's not usually found in esophagus, very uncommon in stomach, mostly Helicobacter pylori and some gram-positive organisms. And from jejunum onwards, it goes on increasing, and highest in the colon, that's 10 to the power 10 and 10 to the power 12 in the colon, which are dominated by the anaerobes, and it's 1,000 times more anaerobes than aerobes in colon. So our gut has tremendous surface area. It's 20 lakh square centimeter, which is equal to a surface, 100 times the surface area of the skin, or equal to that of a single tennis court. The intestinal microbiota includes approximately 700 different bacterial species. This is 10 times the total number of eukaryotic cells in human body. The intestine contains extensive microbiota, that is 1 lakh billion bacteria. It's located mainly in the colon and comprising hundreds of species of bacteria. Various factors such as diets, climates, aging, the environmental condition, medication, illness, stress, everything actually affects this bacteria and causes imbalance, and that may cause disease. So defining probiotic, the term probiotic comes from Latin Greek word pro, before, that means before, that is forward, and bios is called life. So probiotics are life-promoting organisms. So WHO defined probiotics as live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. Mind all the words. So the aspects of probiotics are, it should be alive, it must have undergone an enrolled evaluation, and it should have a documentation of the evaluation, and it should have health benefits, and it should be taxonomically defined what we are giving to our patients, and it should be safe to use, and that should be evidence-based. So what are the commonly heard probiotics? We all know that there are lactobacillus species, there are bifidobacterium species. These predominate especially in the infant gut. And others which are more coming up, those are bacillus species, those are bacteria and bacterial spores, and those are Bacillus cereus and clausii, and non-pathogenic bacteria, Escherichia coli, and the fungus, Saccharomyces cerevisiae, Saccharomyces boulardii, and all these are coming up in a new way, and we are discovering more and more. So what's the origin of probiotics? Eli Metnikov, the Russian-born microbiologist, he first described that those who are actually ingesting yogurt, those who has actually prolongation of their life, they're living longer. So that's why he first defined the concept of a healthy microbiota, the beneficial effect of lactic acid bacteria for the prolongation of life. And later on, lactic acid bacteria was also discovered by Pasteur in 1857 and isolated from rancid milk by Lister in 1878. And 1889, Tessier discovered the bifidobacterium species, which is coming in a big way in different nutritional supplements. And first, stable cultures of Lactobacilli casei was discovered by Minoru Shirota, Russian, a Japanese scientist, and it was named after his name, Lactobacilli Shirota. So when we define microbiota, it comes from the domain, kingdom, phylum, class, family, and species. So like Lactobacillus species, Lactobacillus acidophilus, when we are documenting, we are saying Lactobacillus species, Lactobacillus acidophilus, and define the string with a number usually. So what happens normally? Normally in our gut, the healthy microbiome and the pathological microbiome stay together. Normally they don't cause disease. This state is called the eubiosis state. But when there is a problem, any cause of change in lifestyle, any change in our genetic probability or genetic predisposition, or there is any other medical ailment, that causes dysbiosis. That causes imbalance between them and causes increase in one species and decrease in other species, and the eubiosis gets lost. And ultimately, the host suffers. He suffers from different diseases. It might be intestinal disease, it might be non-intestinal disease as well. So nowadays, obesity, even the fatty liver disease and diabetes, everything is implied by the gut microbial dysbiosis. So in the pediatric population, we know there is role of probiotics in different aspects, including lactose intolerance to treating respiratory tract infection as well. So what are prebiotics? As we discuss probiotics, prebiotics also come together sometimes. So it was first identified in 1995, non-digestible food ingredients which stimulates growth and activity of probiotics. So it's typically usually oligosaccharides. We define them as GOS, like galacto-oligosaccharides, or FOS, fructo-oligosaccharides, or xylose oligosaccharides. These are normally found in breast milk and other nutritional supplements, including lactulose, which we give treatment for our constipation for children. So adding probiotics actually improves the activity of prebiotics. But to get a difference between prebiotic and probiotic, the most important is that prebiotics are not alive. Those are food for the prebiotic, and probiotics should be alive. And prebiotic mostly focus in the colon. It increases the production of short-chain fatty acid. That acts as a nutrition for the good bacteria. But probiotic can act throughout intestine as well as other parts of the body. So what is the role during infancy? Let's see. The infant essentially has an alimentary tract that is very demanding at the upper end and has no sense of responsibility at the lower end. It's very, not very defined. Each baby is different in its behavior. So, but does it contain bacteria? Yes, it does. But from where do these first bacteria get into the neonatal gut? So we have first exposure during delivery. That is, vaginal delivery is more beneficial in cesarean section. And in the second exposure comes from during breastfeeding. And the third and subsequent exposures comes during and after weaning and with the environmental factors. What about exposure in utero? Though it has been defined that placenta is not very absolutely sterile, but infant GI tract is relatively sterile, so that even there might be a small amount of bacteria which is usually inactive. The first inoculum comes from baby's mouth, and this comes to baby's mouth and it goes down to the intestine, and it has been studied. In one study by Carlson et al., it was found that baby's mouth was swabbed and mother's rectal vaginal was swabbed, and they were cultured for Lactobacillus acidophilus and Jansseni, and high correlation between oral cultures and rectal vaginal cultures at birth. And on day 6, oral cultures became negative, and from the feces, we got the same bacteria growing. So, message is that first inoculum comes from maternal vagina and perineum usually. We know breast milk is the best for baby, and exclusively breastfed babies often have less of the diseases like otitis media, atopic dermatitis, wheezing, asthma, respiratory infections. These are all proved. These are all evidence-based. And they also have, even if they are fed with infant feeding formula, the breastfed babies always have an upper hand when they have both. And breastfed babies are always healthier than compared to the formula-fed babies. And human breast milk is not sterile. It contains beneficial bacteria. And the important species are lactobacillus and bifidobacterium. We can see the different composition of bifidobacterium in breast milk. See, bifidobacterium longum and bifidobacterium lactis actually takes the upper hand as percentage. And lactobacillus in human breast milk has been defined in different countries and different racial population. And there we have seen in most of the population, lactobacillus and bifidobacterium goes hand in hand. And in South Korea, lactobacillus has slightly upper hand. So how this healthy bacteria reach human breast milk? It gets absorbed through the lymphatics and ultimately reaches the bloodstream, and through lymphatics as well as bloodstream, it comes to the breast milk and ultimately gives beneficial effects to the children. Which bacteria are predominant in the infant's gut, especially during the first 6 months? If you see by this nice curve, we can see bifidobacterium reaches from 5 days onwards, reaches a peak around 3 to 4 months. So by 6 months, this is the most populous bacteria in the infant intestine. And Bacteroides gradually goes up from 30 days onwards, and it keeps going till up to even after 2 years. And Lactobacillus species, though reaches its small peak in 3 to 4 months, but it goes on increasing after 1 year more. So Bifidobacterium is a very predominant species in babies less than 6 months. So what are the benefits of lactobacillus and bifidobacteria? What they do? They produce lactic acid, which lowers the pH, inhibits pathogenic growths, and produce bacteriocins and organic acids and H2O2. These are causes combating the infection, and this destroys pathogenic bacteria. Competitively, it inhibits the pathogens, and as well as it increases the phagocytic activity of the immune system. It increased natural killer cell activity and increased local secretory IgA production. So all are beneficial. So we can say it is an important role in immunity. Bifidobacterium lactis effect on gut maturation and gut immune functions. We can see from this picture that it increases the secretory IgA, as well as phagocytic activity and T helper cell function. So it has a great role in the immune mechanisms, and especially it plays a very big role in the infants less than 6 months. So as a whole, probiotic has all these effects. It aids in digestion, it improves bowel movement, produces beneficial effect on health, prevent harmful bacteria from multiplying in the intestine, and they can be ingested as a food, and they reach the intestine alive. That is most important. So in first 6 months of life, if breast milk is the gold standard, we know, but if breast milk is not available or inadequate, then infant gut might be deprived of the beneficial bifidobacterium. So how can that be compensated? So can they get it from animal milk? We don't actually recommend animal milk in infants. So infant formula without probiotics, will that help? Or that normal dieting process and environment will influence the bacteria? Or we want a supplement or infant formula which actually has a probiotic as an additive. So first 6 months, animal milk might be economical, but it's nutritionally deficient and it's not recommended. Standard infant formula, lack of probiotics, so there is infant gut is deprived of the beneficial bacteria. So if breast milk is unavailable, we need to provide an option which is closest to breast milk. Should we supplement all children with the probiotic formula? It's still not defined. So let's define whether there is any evidence regarding supplementing a formula with probiotics. So there are so many studies regarding probiotics, and it's increasing day by day. In last 5 years, the probiotic studies has been enormous. If you see that RCTs are 663 in 2011 with a meta-analysis of 77, and then it went on increasing in 2013, 810, and now its last 2 years, it has increased to more than 1,400. The different randomized clinical trials in different diseases, and meta-analyses are also increasing day by day. The real concern is that first inoculum when it comes from the maternal vagina, but cesarean section is increasing. So that first inoculation becomes delayed if there is more cesarean section. In India also, the cesarean section rate has increased to about 25%. So might be first inoculation becomes late, it might be detrimental for the fetal intestine. So increased intestinal colonization rate of bifidobacteria similar to exclusively breastfed infants has been shown when a formula is supplemented with a bifidobacterium lactis formulation. So it has shown that it's about 60% has the same bifidobacterial counts in the feces. So similarly, secretory IgA against rotavirus has been defined in cesarean section delivered babies when we have supplemented them with the formula with probiotics compared to the formula without any probiotics. So it has been suggested in different journals that probiotics may offer a safe means of reducing risk of acute otitis media and antibiotic-used associated diarrhea as well as respiratory infections. So in an Esfagan position paper, they basically mentioned that probiotic supplemented formula to healthy infants does not raise any safety concerns because they have done a huge meta-analysis from different RCTs, and they said that few of those formulas have associated good clinical benefits in different aspects of life. So what are the mechanisms of lactobacilli? It has the same mechanism as bifidobacterium as I have discussed. And in a different study, it has been seen that bifidobacterium lactis supplemented formulas has given very good results in preventing diseases in different populations of children. In the populations of daycare centers, in populations of antibiotic-resistant diarrhea, in population with infants and toddlers, in hospitalized sick patients. So it has given good results, so it has evidence-based in it. 48% reduction in prevalence of antibiotic-associated diarrhea has also been demonstrated by bifidobacterium lactis. And Esfagan, as I have mentioned, that bifidobacterium lactis alone or in combination supports normal growth in healthy term infants and is not associated with adverse outcome. That has been specifically said in their position paper. So bifidobacterium lactis in infants and toddlers has clinically been proven to be safe and long history of safe use. So it has been approved for use in formula of infants and toddlers. Lactobacilli and bifidobacteria are together, they're safe, usually found in fermented foods, and host's own microflora, they are part of the host's own microflora. So it is found in oral cavity, ileum and colon, and vagina. So it didn't account for any severe infections in children. It's accounted for only 0.05% to 0.4% of infective endocarditis and bacteremia in a very, very small population. And there's review of 143 human clinical trials up to 1988. and there was no reported adverse side effects of these supplements. So this is another study. Here are a few studies of probiotics in different diseases, and which will prove that if we supplement something, that might give a very good results to our infants in prevention of diseases. So in one of the systemic reviews of more than 9 studies, it has found beneficial in infectious diarrhea. And in one of the meta-analysis of 5 randomized control trials in adults, data favors its use in constipation, though the study was done with Lactobacillus casei, and it was more beneficial than Lactobacillus rhamnosus GG. Though in children, we need more studies to come up. In NEC prevention, there is highest studies has been done in children as well as premature children. In these cases, it has always shown a good advantage while probiotic supplements have been used in these children. And more research, though, is needed in very low birth weight premature children. It reduces all causes of mortality in NSC. One of the good meta-analysis, it has been shown that all the benefits of probiotic supplemented formulas or probiotic use is in favor of the probiotics. So this is one study by Lin et al. It significantly lowered the NEC mortality. It has very low severe NEC progressing from mild NEC, and no positive blood cultures were found from Lactobacillus and Bifidobacterium, which has been used for the supplementation. So it reduces all causes of mortality. And in colic, there are studies, though we routinely do not give, but it is evidence-based that it has good effect compared to simethicone, which is usually given. In eczema also, it has action on prevention, and it also prevents the respiratory illnesses, as well as nosocomial infections in different studies. So we know that as we sow, we will reap like that. So if we give something which can prevent many diseases, then it will be really beneficial for our children, and ultimately they can grow up healthier. So to summarize, probiotics are good bacteria having definite benefits for adults and children. Breast milk is non-sterile. It contains lactobacillus as well as bifidobacteria, and this is the important probiotic source in human nutrition. Breast milk is gold standard for first 6 months of life, but infant's gut is dominated by bifidobacterium. And if breast milk is not available, infant formula fortified with bifidobacterium is the next best possible choice for adequate nutrition. And as we are moving towards an era where probiotics will come as a treatment and prevention of many diseases, not antibiotics, not other medicines, then the supplementation from the very beginning to prevent diseases should be a good choice. Thank you so much for your patience here.